This is the gateway plastic surgery that so many of my patients are coming to the office and signing up for left and right. What is it? We're going to talk about this and much more in this episode of the You Are Beautiful podcast.
You Are Beautiful podcast with Jae Kim, ND.
Welcome to this episode of the You Are Beautiful podcast with Jae Kim, MD. I'm your host, Dr. Jae Kim, a facial plastic surgeon in the DC metro area. I'm on a mission to make the world a more beautiful place, starting with you. There are 3 core truths you must embrace to achieve the most beautiful version of yourself. The first is that you are beautiful. The second is that you are unique. And the third is you are worth it. Let's dive into today's episode. In 2025, plastic surgery is more popular than ever. It's all over the internet, on social media, with celebrities, influencers, and ordinary people alike. So what is the new surgery that they're all doing? This is the topic of today's episode. If you've been following along on the You Are Beautiful podcast, we talk about all things related to your beauty and medical aesthetics. Today, we're talking about, yes, the upper blepharoplasty, aka the eyelid lift. A lot of people are coming to the office. They say they had never considered plastic surgery. And somehow or another, maybe a family member or something they've seen on Instagram or YouTube, they say, my eyes look hooded. And I'm looking at this person and their eyes look bright and refreshed. What's going on here? Well, the simple answer is that many people are signing up for upper blepharoplasty, aka eyelid lift surgery. This surgery has gained popularity for many reasons, but one of the most important reasons is that it's not just improving your appearance to make you look younger and more refreshed. For a lot of people, it's about helping you not to have to raise your brows to open your eyes to see better. So we'll get into the details of what exactly is going on with upper eyelid surgery, including why some people do it, what is involved in the day of surgery and the healing process, all the frequently asked questions about the surgery and going through the process of achieving a more beautiful version of yourself. So first things first, what is upper blepharoplasty? Upper blepharoplasty is a cosmetic surgery that we perform regularly for people who have concern about older looking eyes, hooded eyes, tired looking eyes. These are some of the common complaints that my patients come with. They say, my eyes look tired. I feel young, but I don't look that way when I see myself in the mirror. And so it is a relatively quick surgical procedure that can be done on an outpatient basis, oftentimes without any general anesthesia. And immediately you see a result of a brighter, more beautiful version of yourself. This is why this surgery is gaining in popularity so much. The other added benefit is that recovery time is relatively short compared to other aesthetic or plastic surgery procedures. In recent years, more and more people have looked at themselves in the mirror or have thought about their appearance because of what we see on our phones. Whether we're taking selfies, whether we're looking at pretty people on social media, or reading about other people's beauty experience and transformation, there is a lot of information that we are consuming that leads us to think about our appearance. And so when I think about facial beauty, I think about how we would glam up our beauty. A lot of the principles around applying makeup are centered around jazzing up the eyes and the lips. And so if you think about wearing jewelry, for example, they're like bracelets, rings, necklaces, and the like. So one of the great ways to accentuate the beauty of your eyes is to draw makeup along the upper lashes. And by doing so, it gives the appearance of larger eyes. And larger eyes historically indicate and exude more confidence, more attention, more beauty, more attractiveness. And so this is a very desirable trait to have. When your eyes are hooded like this, and I'm exaggerating for those of you watching on YouTube, when your eyes are hooded like this, it makes you look inattentive. It makes you look tired. It makes you look less virile if you're a guy and less sexy if you're a girl. So, what's to do about making your eyes prettier in a more permanent way? This is where upper eyelid surgery comes in. Historically, the most popular facial cosmetic or plastic surgery used to be rhinoplasty. And it still is a very popular surgery because it helps improve the appearance of your overall beauty, as well as it can help you breathe better if you don't breathe well through your nose. But slowly but surely, actually not so slowly, kind of meteorically speaking, upper eyelid surgery has been on the rise. And so many, many more patients proportionally in practices like mine come for eyelid rejuvenation. So another aspect of what makes eyelid surgery so appealing is that it's a relatively small surgery in speaking of facial surgery in general. When you're looking at the area of the upper eyelid, it's a very small part of our face and an even smaller part of our entire body. And so when you're working on a small area, the change that you may see and that other people may notice is relatively small, right? If you're getting a breast augmentation, you can make a quite drastic change. But if you're performing eyelid surgery in a very small area, the change that will happen is relatively small in comparison. That's why as more people do plastic surgery, the more the theme is around changes that are relatively undetectable, that are natural, that still look like you, just a younger version of you or a more refreshed version of you. That way, when people see you, they're not like, oh, you had something done, and they gasp and gawk at you. That's not what we're going for. It's really what is, did you go on vacation or have you been sleeping better? Plastic surgery in 2025 is less about drastic changes that you look less like yourself and more like someone else that you're not familiar with. It's really more about how do I enhance my own natural features so that I can present a more beautiful version of myself to the world. And that's really what we're about here at my office, is to help you present the most beautiful version of yourself to the world. And upper eyelid surgery is a great way to do that. The subtle changes that you see after upper eyelid surgery are very nice. And you still look like and feel like you're seeing yourself in the mirror, just a more refreshed version of you. People are not going to stop and do a double take when you're running errands or going grocery shopping, for example, when you have upper eyelid surgery. And people who know you may notice but not know exactly what happened. And that's what so many patients these days are going for, is that I want people to notice but not know what happened. And so upper blepharoplasty is a great way to let that happen for you. One of the most frequently asked questions about eyelid surgery, but about plastic surgery in general, is what recovery is like. And so to that, I will say that recovery is relatively short. You could go back to work, assuming your work is not physically intensive, in a few days. People may not even notice at that time that your appearance is different or that you're recovering from a surgery. In fact, they may just think that you had a spa day or a long, relaxing weekend or something. And the good thing about it is that it's not a long recovery process. I tell most of my patients that they can go back to full exercise and physical activity in 2 weeks' time. Other plastic surgery procedures may usually require a longer downtime period, up to a month sometimes, or even 6 weeks until you can do things without any restrictions. So in the grand scheme of recovery for plastic surgery, upper eyelid surgery has probably the shortest recovery time. Another frequently asked question about recovery is, will there be pain? And to that, I will answer that there is usually no sharp pain or anything that you can't bear without a little Tylenol or a little Advil. I never give out narcotic prescriptions for patients recovering after upper eyelid surgery. They really don't need it. What some people will do is take Tylenol and then a few hours later, a little bit of Advil, and then a few hours later, stagger the Tylenol and back and forth so that you have the least amount of pain and swelling during recovery. Another frequently asked question is, how long will the result last? I'll put it to you this way. If you do it and your twin does not do it, you will always look better than your twin. And that goes for generally any plastic surgery, and especially upper eyelid surgery. In terms of the hooding coming back, it'll take a while, like a long while, for it to come back. If it took so many years to get to the point of you're wanting to have the eyelid surgery because your eyelids look tired or hooded, then you can imagine it'll take that many more years for that problem to recur, if it ever does. One common question that especially younger patients ask me is, am I too young to have this surgery? And that is a valid question because historically, people think about hooded eyelids for older people, that it's an issue only with older patients. But in fact, you can just be born with smaller eyelids, and that hooding occurs earlier on in life. I have some people even in their 20s who are coming with this specific concern. And so it's really not about the age at which you decide to pursue upper eyelid surgery. It's about what's going on with your anatomy, even if you're young, even if you're in your 20s or 30s. I have plenty of patients, millennial and Gen Z, who opt for this surgery and they get great results. So again, it's not about how old you are as it relates to your eyelid hooding. It's just if your eyelids hood and if you look tired compared to the gestalt that you want to show others. So let's say you've decided to move forward with a consultation with a plastic surgeon like me. What can you expect during your consultation? As a plastic surgeon, first and foremost, I'm also a physician. So I want to make sure that your eyes are in good health. This is why I send my surgical patients to an ophthalmologist for an eye checkup so that we have a baseline of your eye health before we do anything cosmetically related. Some things that might need to be addressed or at least evaluated prior to surgery are issues like glaucoma or retinal issues or something like macular degeneration. These are all related to your eye health. Another parameter that we want to measure for is how much tear production your eyes make, because one of the common things that people might experience after upper eyelid surgery is dry eyes. And this is especially true if you already have dry eyes at baseline. Because of the recovery process, sometimes people's eyes will feel drier, especially during the first few days after surgery. So we want to make sure that your eyes are in good health, that you're able to make enough tears to protect your cornea so that we get the best outcome possible and you still have good eye health. During the consultation, I will sit with you in front of a mirror and I'll have you explain what your goals are. And I think it's very important that patients have clear goals when it comes to even something relatively small like upper eyelid surgery. If the hooding is what you want to get rid of, then that's a specific goal that you want to have. When it comes to certain appearances, like my eyelids look too bulgy or there's too much bulging right over here above the eyeball and below the brow, then that might be another issue that we can address at the time of surgery as well. When I examine patients during consultation, I take into account all the possible anatomic factors. And I'll save that for another video, but safe to say that there are a few considerations when it comes to changing the anatomy of the eyelid to help facilitate the most natural and also the most beautiful possible result. If you want to see a video about that, please comment down below and make sure that you follow on the audio platforms and subscribe to YouTube for more great content to come for you, the patient. So on the day of surgery, what does it look like? Well, you certainly don't have to go under general anesthesia. All of my patients basically are able to have this done under local anesthesia. I actually ask you what your musical preferences are so that we can listen to your favorite music during the surgery. I have a couple boundaries when it comes to music. Nothing too loud like metal and nothing too sleep-inducing. So I generally go with 90s music, but again, patient's preference will trump that. Some patients ask me, how much skin will you remove from my upper eyelids? And for every patient, that's a little bit different, of course. The most skin I've ever removed from a patient is a strip of skin about almost an inch wide. And if you can imagine, I mean, from my brows to my lashes, it's about an inch. But believe it or not, there are some situations where people's eyelid skin is so hooded that removing an inch thick strip of skin is actually the appropriate thing to do. Another common question that people have is, how will the scarring look? And this is perhaps one of the fears of plastic surgery in general, is that one of the ways that people think that it's going to give them away is the appearance of a scar. Now, when it comes to upper eyelid surgery, the great thing about this is that as long as your eyes are open, nobody can see your scar. And so it's easy to hide. And if somebody's looking at you when your eyes are closed, like if somebody's looking at you really closely when your eyes are closed, that's weird. Maybe you shouldn't hang around that person. So it's safe to say that for most people who pass by or are spending time with you as you're awake, they're really not going to see the scar. That's another good reason why it's very easy to swallow the idea of nobody's going to see the scar, and so it's going to be a nice facial rejuvenation for me, and I'm going to know about it, and people might notice, but they might not know what happened. So for the vast majority of patients who have upper eyelid surgery with me, the scar is not an issue. It heals really, really well. The chance of a scar being too wide or too thick is very, very, very slim. And so when it comes to hiding the scar, really, the eyelid skin is the thinnest on the body, anywhere. And so thin skin heals really well, and especially when there's no tension on it whatsoever. Because when your eyes are open, the incision is not under any tension at all. Another very common question that patients ask is, will I be able to close my eyes when I try to sleep tonight? And that question is not uncommon, especially the morning of surgery. And to that, I'll reply that really the risk is slim to none, because I know how much skin needs to be left behind so that you can close your eyes well when you sleep. That's especially important when I consider people who have dry eyes, because it's especially important for people who have dry eyes to be able to close their eyes when they sleep. And so by removing just enough skin so that you're able to close your eyes still, you get a nice refreshed result. Another reason why upper blepharoplasty is so popular in 2025 is because there's relatively low risk of adverse events with this surgery compared to other facial plastic surgery. I always start with the risks by telling my patients that I could blind you. The fact of the matter is, I'm working with very sharp, fine objects near your eyeball. And if I drop something, I could blind you. That has never happened, and it will never happen. The other thing to consider is that sometimes there might be a numb spot along the skin of the upper eyelid, and that's totally normal. That will come back as you heal. So upper blepharoplasty, or eyelid lift, is a very popular facial plastic surgery. It's one of the most common surgeries that I perform, and my patients have wonderful results, and they have minimal to no downtime, and they still feel like a more refreshed version of themselves without looking done and without feeling like they look so different. That's what we're all going for. And my mission, again, is to make the world a more beautiful place, starting with you. I think upper blepharoplasty in the hands of a very skilled plastic surgeon is a very nice way to help you look more refreshed, to present your most beautiful self to the world. If you have other questions, please feel free to leave them in the comments section or leave a review with your feedback about this episode and what you would like to hear about more. If you are strongly considering the upper blepharoplasty as part of achieving the most beautiful version of yourself, please contact the office. The contact information will be in the description below. And if you have gone through this upper blepharoplasty procedure, I'd love to hear your feedback. In 2025 and beyond, upper blepharoplasty is and will continue to be a very popular surgical procedure. You may not even know that somebody you know very well had it done. It's that natural, and the results are really wonderful. You'll enjoy it for the rest of your life. And not only that, for a lot of patients, you'll be able to see better without wrinkling your brows like this. So if you're interested in having surgery, or if you're interested in other ways to achieve the most beautiful version of yourself, feel free to leave a comment in the comment section down below. Feel free to review if you're listening on audio platforms, and we love your feedback so that we can create better episodes so that this can be an even more useful resource for you. Thank you for tuning in to this episode of the You Are Beautiful podcast with Jae Kim, MD. If you want to learn more about other procedures, such as rhinoplasty, we'll leave a link for the rhinoplasty video that I recorded recently in the description as well. I'm on a mission to make the world a more beautiful place, starting with you. Again, you must embrace these 3 core truths. You are beautiful, you're unique, and you are worth it. Till next time, take care.